Are you caring and compassionate? Are you ready for the next step in your career? Are you thinking about returning to healthcare? There has never been a more exciting time to join the NHS family. We are recruiting now. We are expanding our services and we have opportunities for you. Look at our brand new 2-storey acute medical unit. You could be working here. Whatever role you choose or speciality you settle on, you'll be trained and developed in a safe, supportive and inclusive environment. We are recruiting now for nurses.
I've always worked within surgery, and I think really the matron role is to inspire and lead others and to show nurses the correct way to nurse and to treat patients, providing the best patient care possible.
So I work in accident and emergency department, which is a really good place to start as a newly qualified nurse. You meet people from every walk of life, and the most important thing is you never know what's going to actually come through the door.
I've been qualified 25 years and came to Dudley 23 years ago, initially working on the coronary care unit and the haemodialysis and COPD renal unit when it was based at Worsley Hospital. In 2001, I became a district nurse and 8 years ago developed the community IV team for the Trust. This means that I help a team of nurses care for a group of patients requiring all different types of intravenous therapy in the community setting. That's in their own home, in our community clinic, or in residential and nursing homes within the borough.
It's a long day, I'm not going to lie. We start early, sometimes we finish late, and I think to be a nurse you have to be really dedicated. Our ward routines, we help patients to have washes, we help to feed patients, we're part of the doctor's ward rounds, we're part of the multidisciplinary ward rounds, so we're working with OTs and physios, dietitians, so we're constantly assessing patients' needs, helping to get patients out of hospital after the right treatment.
We don't really have a typical day because each day is completely different to the one before. However, it is structured in the fact that we give intravenous antibiotics twice a day to patients that require this type of therapy. We have an oncology clinic where we care for patients going through chemotherapy who have central lines in place. We do their pre-chemotherapy bloods, we care for their line on a weekly basis, and we disconnect their chemotherapy infusers.
When you come and start here at Dudley, you get loads of support as a newly qualified, and they make you feel welcome and part of the team.
It's wonderful when we can help a patient who's been critically ill in hospital become well in the community and then be free of their infection.
So I really like working in Dudley because every time you walk down the corridor, all the staff and patients goes morning, good afternoon, which is quite welcoming, and it makes you feel part of the team.
For me, it's a great family feeling here. It's a close community. I feel we really look after all of our staff, especially our nursing staff. We offer great support. But also from a personal point of view, my dad was very ill for a long time when I was a child and into my teenage years, and this hospital and the doctors here really cared for my dad and supported us as a family.
The wonderful thing about nursing is that no 2 days are ever the same. No 2 patients are ever the same. And we can care for that patient and their family with true care and compassion.
It's a wonderful, wonderful job. It's the most satisfying job you could ever have, to know that you're making a difference to people's care, to their health, to their well-being. You're helping families, you're supporting patients. For me, there's no better job.
Our talent is finding yours. We are recruiting now. Come and be a part of something special.